tissue trauma-related edema, a common condition after local surgical interventions or athlete injuries, when more liquid than normal is found in intercellular distance. A new molecule called external inorganic gel liquid magnet has been developed in combination with silica, calcium chloride, tetrahydropiperin, which have a very high water holding capacity. External inorganic gel liquid magnet is a new generation patented molecular structure with high hydrophilic feature that is not likely not to be absorbed from the skin. It is applied as a layer with a minimum thickness of 3 mm to cover the entire edema area that occurs after tissue trauma. The area of application is covered with sterile bandage and kept waiting for 12 hours. Cosmopolin, which is found in the gel, supports increasing the fluid permeability by expanding the porous structure of dermis and epidermis. Having a high water holding capacity, the external inorganic gel liquid magnet, which is not absorbed from the skin, binds the edema liquid under the skin to the molecular structure, thanks to free silynyl groups, and restrains it into the gel complex. It ensures faster transport of edema liquid. The edema area becomes normal within 3 to 5 days.